Good afternoon. I'm George Latimer, Westchester County Executive, and this is our Monday, October 4th update, Westchester County issues, including COVID information for our residents and neighbors here in Westchester County. I'm joined, as I always am, by our Deputy County Executive, Ken Jenkins. We'll be talking about a number of different issues today, and when we have a chance to cover those, we're going to have some of our senior managers, leaders in various departments in Westchester County government to talk about a very important issue that we'll reach in a few minutes. Let us start, as we generally do, with COVID information. The general news is that COVID has been on the decline in Westchester County, number of infections, number of hospitalizations over the last 3 to 4 weeks. That is good news. That represents a diminution in the infection that rose in late June due to the Delta variant. And we saw a surprising number of cases in July when we didn't expect it. I think it made people feel very concerned that we were heading for another major spike. And we had twice before in the very beginning of the pandemic, and then again last year around the holiday season into the very beginning of the new year, before there was vaccinations, we reached numbers of 11,500, 12,000 active cases. Active cases being people who've tested positive over the prior 2-week period and not yet going through the period of time for the disease to incubate and then be fought off. So there was a great concern that we were heading in the same direction in July, and we saw that increase through July and into August, but now we're seeing a diminution over the last month, which is good news, and we'll give you some comparisons between where we are today and where we are approximately a month ago. Our numbers through the New York State Tracker as of yesterday, Sunday, October 3rd, we have 1,668 active cases of COVID. 1,668. When we look back into the more recent period of peak infection, on Saturday, August 28th, slightly more than a month ago, we had 2,836 cases. So we went from 2,836 down to yesterday's number of 1,668. That's a significant drop, not quite 50% drop, but very close to it. In terms of hospitalizations, which is the degree of severity of the disease, how many people are hospitalized, how many are infected, but how many, having been infected, are hospitalized because of COVID, we had 110 people hospitalized the last week of August at a peak, and the most recent number we have dates back to Saturday, 52 people hospitalized, and that is a 50% drop in the number of people hospitalized. So that's good news. That number is going steadily down from the peaks around slightly over 100. These numbers, the peaks of August, were nowhere near the more significant peaks that we had in January of this year and then back into April of last year. But there's still a good diminution. So we hope this is the trend, but we still have to see what happens as the weather gets colder, as we move indoors, and the disease spreads more easily indoors than it does outdoors. So we're by no means through the worst of this. But we're progressing ahead, and we think those numbers are very encouraging. And we hope that when we report again a week from today, or whenever we report, next Monday being a federal holiday, we will be able to continue to show a good progression of numbers. On the vaccination side of the equation, we have 735,541 Westchester residents, 18 years of age and older, who have been vaccinated with at least one vaccine dose, and of that total, 658,317 have completed their vaccination series, meaning 2 shots of Pfizer or Moderna or 1 shot of Johnson & Johnson. We expect the gap between those two numbers to close over the course of the next few weeks so that the 735,000 now will be the baseline of the number of people vaccinated when we go through the 3 or 4 week waiting period for the second doses. And meanwhile, the first dose number will rise. So we're very encouraged now that we have 89% of the Westchester population, 18 and over, that have gotten at least one vaccination dose. Consider that. We're just short of 90% vaccinated in Westchester County. We have outpaced our neighboring counties, Putnam, Dutchess, Orange, Rockland, the Bronx, Ulster County, Suffolk County. We know that the numbers in New York State are far greater in vaccinations than they are in some of the southern states, some of the Rocky Mountain states. We understand there's ideological debate going on in possibly every home, much less in every community, over the role of vaccinations. But in this particular county, we have a high vaccination rate, and we have a dropping rate of infection and a dropping rate of hospitalizations. And we think those two numbers are correlated. We have not placed a vaccination mandate in as a county government in any capacity, not to our workforce, not outside of our county government exposure, but we have encouraged vaccinations. And in a second, we'll talk about where we have some additional satellite locations. It is, for my purposes, it has been proven to my satisfaction that vaccinating individuals has made them less likely to get the disease, and that has caused a drop in the number of infection cases. And we're encouraged by that. We hope that that is a sign across the board. Obviously, there are many different people who have different viewpoints. I think the majority of the medical community and scientific community agrees with what I've just said, but there are other voices. So we'll try to stay as close as we can to what appears to be the consensus of people in the science and the medical community, and try to do what we can do to make Westchester as safe as possible with the decisions that we make every day in light of the numbers that we see. But again, 89.1% of the population of Westchester County adults 18 years of age and older have received at least one vaccination dose, and a significant percentage have been completed with their vaccinations. Now, we have Westchester County Center and two Westchester County health clinics that continue to serve as vaccination locations. 20 South Broadway in Yonkers, 134 Court Street in White Plains. Those are normal health clinic locations for Westchester County. We provide other kinds of vaccinations at there, MMR vaccinations for kids going to school, flu vaccinations. I got my flu shot 2 weeks ago, roughly. Feel pretty good. And the situation in those two locations they are available for COVID vaccinations as well. County Center has been a central location throughout the Hudson Valley region. 400,000 plus people have been vaccinated at that site. We are still waiting for certain things to happen in order for us to have a more broad-based use of booster shots. We do not yet issue booster shots at our locations. Local pharmacies have been given that authority to do it. We understand people 65 years of age and older, and those that have certain kind of immunocompromised diseases are eligible for the booster shot. Only eligible if you took Pfizer. If the first two shots were Pfizer, then you're eligible to get a third Pfizer shot if you fall in those parameters. Those of us, including myself, that took Moderna are not yet eligible to take a third Moderna shot. We'll wait and see what the federal government says, and that would also apply to a second shot of Johnson & Johnson, and we'll see how that works. We're also waiting to hear official word for those that are under the age of 12, and I believe they've been testing a Pfizer vaccination for that age cohort. We are advised at the present not to mix the types of vaccinations that we've received. So it's not like, well, I got two Pfizers, let me go get a Moderna. You know, we're not at a buffet line in a restaurant. We are dealing with things of medical specificity. If we want to stay healthy, we try to stay close to what the guidelines are. As the guidelines change, and they do change, we've gone through any number of different changes, how many days to isolate or quarantine, what percentage of people can or can't be in a certain kind of setting, but we're following whatever that advice is. We're trying to make the intelligent decisions we can. So for the moment, third booster shots for people within certain categories, Pfizer authorized, the other one's not yet authorized, and it may come by the end of the month. If it does, we are gearing up as a county government to be able to provide as much vaccination assistance as we can. We have a limited workforce of people that can administer these vaccinations, so we have to work through a host of issues in Westchester County, but we're trying to address them as best as we can. We have one satellite location, one pop-up coming this week, this Thursday, October 7th. There will be a vaccination clinic at Ossining High School in the gymnasium. We encourage you to go to our website, health.westchestergov.com, and you will see all of the public pop-up sessions that are coming up through the end of the month. We know that from time to time there are changes in the times, the hours that they're available. So rather than report today something which could be adjusted as we go forward, we encourage you to go to the website, health.westchestergov.com, and look for those pop-up sites, the dates that they are, and how proximate they are to you, and what kind of dosages that they're providing. And in almost almost every case. We're doing the first initial dose, and then we'll follow up with the second dose in those locations. That they're not targeted as booster locations. And again, this week we have one, Thursday, October 7th, Ossining High School gym. Before the month is over, we plan one at the White Plains High School in the library, right on North Street in the city of White Plains. There's one that is planned at the Highland School Middle School gym in White Plains. That's coming up a little bit later this month. October 22nd is the target date. There's one that is scheduled for the Reformed Church of Cortland Town. That's in the hamlet of Montrose in the town of Cortland. That's scheduled for the 26th of October. And then we have one at the Columbus School gym in New Rochelle on Washington Avenue, and that is scheduled for the 27th. And with each of these updates, we'll provide more information about that. Again, go to the website, you'll get details, and we'll keep you posted on the vaccinations that we're doing through county government. And then you can also consult your local pharmacist wherever you go normally to have your prescriptions filled. If they are a location that are dispensing vaccinations, they'll give you the backdrop for what they're doing. But as a general caveat, we're going to try to continue the vaccinations, making them available. We're making a host of different services available to different entities. We'll be speaking to municipal governments later today. We had a conversation with school districts this morning, and we're trying to be helpful in any way we can as a county government. We are not the primary source of the policies on these things. We have a role to play through our health department, but we are trying to be a partner to all those other entities in Westchester County so that people can be vaccinated, can get PPE, masks, and so forth in a convenient fashion. Want to mention as well that from the mask standpoint, we have been providing masks for children in schools, elementary schools. We've given distribution to a number of the major school districts. Their voluntary desire to have them, we have obtained them and provide them. I've been personally there. Ken has personally been there in Yonkers, the Yonkers School District, the Bedford Central School District, a number of others in White Plains where we've made the effort of giving out them. And many of those school districts are calling us and getting additional information. We continue to provide that, masks along with hand sanitizer and some other things that may be helpful to them in executing this. With that, I want to mention a few other things while we're together. We have a major issue coming up, which will take a little bit of time here, but we'll click off a few other smaller things. You notice that we celebrated Hispanic Heritage Month, which began in the middle of September and extends into October. October is the month for Italian Heritage Month. That's one of the heritages that I personally share. And tomorrow, Tuesday, October 5th, we will be raising the Italian flag at Kensico Dam Plaza. That'll be at 3:15. We welcome those in attendance. We'll be socially distanced, so there won't be an issue, a problem. We'll have individuals in the Italian-American community to join us for that moment where we appreciate the Italian-American presence and heritage here in Westchester County, as we do for as many ethnicities and as many different demographics as we can. It is a wonderful mosaic of this county, and we're certainly pleased to be able to have that recognition, which should be some fun. Again, in the days of COVID, we can't be as close and as connective as we'd like to be, but tomorrow, 3:15 at Kensico Dam Plaza. I might point out, we have often raised the flag here in front of the county office building on Martine Avenue, but we have major work being done to the building to upgrade it and the scaffolding all along the face of it. So to have a good look of it, we're at Kensico Dam Plaza for tomorrow. There should be a flyer that you may see on the screen. Hopefully that's helpful. We want to acknowledge the passing of a Westchester icon. Armand Chick Galella has been with us for many, many years. He's lived almost to his 100th year, and he has been a tremendous asset in the Sleepy Hollow community. He was a Pearl Harbor survivor. The attack that occurred in December of 1941 gives you an idea that he was active in World War II, how long he was a resident here. He's one of our last survivors of Pearl Harbor. He was also one of the first individuals to cross the Tappan Zee Bridge in 1955, and he crossed the new bridge that took its place in 2017. Chick was an advocate for fallen heroes, for Gold Star families, and for veterans. And he died on September 29th, unfortunately, after being diagnosed with COVID-19. He will be buried this week with military honors. His casket will be covered in an American flag, which befits a hero. Our thoughts and prayers are with his family. He will be waked both today and tomorrow. Immaculate Conception Church in Sleepy Hollow will hold his funeral mass. We extend our condolences to the Galella family and to all who knew Chick in the community, which was a legion of people. We hope for him a peaceful rest, and we thank him for his tremendous service to this country and to this county, and we will not forget Armand Chick Galella. I want to ask Ken to now talk to us a little bit about the efforts we're going to be making. It's part of Mental Illness Awareness Week. We were here a couple of weeks ago to talk about our desire to focus on prevention of suicides and also to recognize those that had completed suicide as a positive remembrance for their life and not necessarily their means of death. So Ken is going to talk a little bit about an initiative in that area. Deputy County Executive Ken Jenkins.
Thanks, George. As Westchester County joins around with communities around the nation in recognizing Mental Health Illness Awareness Week. Mental Health Illness Awareness Week runs through Sunday, October 10th, which is also World Mental Health Day. So it runs this week till October 10th to celebrate and coordinate with World Mental Health Day. Upholding Westchester County's commitment to educating residents on the importance of overall mental health, I want to announce today the creation of a planning committee that will be making recommendations and working towards the creation of a memorial for those who have ended their lives by suicide in Westchester County. This permanent remembrance will help build awareness of suicide prevention and create a place of reflection for family members and loved ones for those who have ended their lives by suicide in Westchester County. The importance of Mental Health Awareness Week is even more relevant today than ever before as we face the challenges of the pandemic as well as other life challenges. We're looking forward to the recommendations of the Planning Committee for that remembrance in Westchester County that's going to provide that peaceful site for reflection for family members and loved ones and help address the stigma that's often attached to mental health needs and build awareness. The Planning Committee is going to consist of appointed members, including survivors, advocates of suicide prevention and awareness efforts, and leadership from county departments. That committee is going to hold its first meeting on October 19th and present its full recommendations to the county executive by January 2022. We also have several Mental Health Awareness Week activities. One, tomorrow, the National Day of Prayer for Mental Illness, Recovery, and Understanding. That's October 5th. On October 7th, on Thursday, National Depression Screening Day. On the 9th, NAMI Walks United Day of Hope. NAMI's done a fantastic job here in Westchester County, and the county executive I've participated in walks before with Commissioner Orth. And then again, ending on October 10th for World Mental Health Day. Every year, millions of Americans face the reality of living with a mental health condition. However, mental health illness affects everyone, whether it's directly or indirectly through family, friends, or coworkers. And that's why each year during the first week of October, participants across the country raise awareness for mental illness, fight discrimination, and provide support through the Mental Illness Awareness Week. And we really are going to continue to work hard to have that remembrance happen for our Westchester residents. Thank you, George.
Thank you very much, Ken. Now I'd like to ask a couple of folks to join me here on the stage, and we'll go over an issue that they've been working on very diligently that we think is very important. With us today is Dr. Shalita Amler, who is our Commissioner of Health. We'll ask our Commissioner for Mental Health, Michael Orth, to join us here as well. We have our first Deputy Commissioner of the Department of Social Services, John Befus, with us. Lisa Syron, who's coordinator of the Child Fatality Review Team for Westchester Institute for Human Development, and Karen Aaron, President and CEO of Feeding Westchester. So if all of our friends will join us here. We are here to talk about another one of those designations that comes in the month of October. Please all come a little bit close together. And that is that this month is an awareness month for sudden, unexpected infant death syndrome, known as SUIDS. This is a concern about infant deaths that occur when babies are sleeping, and they are not sleeping in a safe manner appropriate to their age, and they are vulnerable to losing their life. Terrible tragedy for a family to lose a baby at this stage of their life development. They're going to talk a little bit about what the efforts are, the joint efforts between social services, our health department, community mental health department, the Westchester Institute for Human Development, and Feeding Westchester to sort of spread the message about the ABCs of safe sleep. They'll cover the fact, no doubt, all babies should be sleeping alone, on their back, and in a crib. That's the ABCs. But we'll let these professionals highlight some of these things. It's a concern of every parent. I'm the proud father of a 36-year-old grown woman with 2 children of her own, but when she was a baby, this was a fear that we had as well. So it's a common concern for all of us, and by raising awareness in this month through public education, we hope to reduce the incidence of SUIDs affecting people. So let me first ask our First Deputy Commissioner, Department of Social Services, John Befus, to join us here, and then in sequence, the other speakers, and you could each introduce yourself. We'll have Dr. Amler speak, and then Lisa Syron, and then Karen Erin. But first, John Befus.
Thank you, Mr. County Executive. Hello, my name is John Befus, and I'm the First Deputy Commissioner of the Westchester County Department of Social Services. And on behalf of Commissioner Towns, Deputy Commissioner Hines, our child welfare team, and our partners with us here today, we're here to discuss this very tragic and heartbreaking subject of unsafe sleep in Westchester County, resulting in fatalities. And it's our job in social services and working with our other county departments and partners to not only support those that are affected by and impacted by these fatalities, but also to help prevent them in the future, because they are preventable. Since 2006, working with our county child fatality review team, including many of the partners here, Westchester County Health, the Medical Examiner's Office, Department of Community Mental Health, Department of Emergency Services, our law department, as well as the district attorney in the county, law enforcement, victims assistance, and our WIHD coordinator, we've been working for years to try and promote the message of safe sleep and the ABCs, as the county executive mentioned, alone, on their back, in a crib. That's the most important message. It hasn't changed, but it's something that needs to be reiterated. Historically, unsafe sleep environments are involved in more than a third of the cases that we review through the Child Fatality Review Team, in nearly 2/3 of the cases for children under age 1. And we've actually seen a recent increase from about 3 cases per year to 4 cases of those unsafe sleep fatalities. So it continues to be a concern. The message is the same. And we've also updated the flyer, which will be distributed and shared throughout the county. We work every day through our Child Welfare Division to promote safe sleep, but working with the food bank today and others, we're going to continue to distribute the flyer that shares the ABCs as well as other guidance on how babies and young children sleep safest. So thank you again, and certainly it's not an easy subject, but one that's important, and we're glad to be here to help promote.
Thank you. John Befus. Now Dr. Shalita Amler.
Good afternoon. I'm Dr. Amler. I'm the Commissioner of Health for Westchester County. New parents have so much to learn when their baby is born, and they're constantly being bombarded with information, and sometimes it's hard to process all of the information that they get. But the information around safe sleep is especially important. And so we understand that parents get a lot of conflicting advice from well-meaning family members, their neighbors, and everyone else they know. But we want to point out the fact that when it comes to keeping your child safe when they're sleeping, it's crucial to parents that they insist that everyone who is caring for their child do what the experts recommend. And as you just heard from Mr. Befus, that is following the ABCs of safe sleep, which is babies should always be put on their back, they should always be alone, and they should always be in a crib. And so after a late night feeding, we want to make sure that baby goes back into their crib, that they never fall asleep with the baby. You never allow yourself to fall asleep with the baby in the bed with you. That they go into their crib where there are no pillows, no blankets, and no stuffed animals or other things that could act to actually cause the child to suffocate. So babies, most people think that babies will get cold and they need a lot of blankets, but in fact, babies just need one extra layer of clothing more than you do. So whatever takes to make you feel warm, just add one extra layer to your baby and they should be fine. So cotton or fleece sleepers will help keep them cozy. And just a reminder again that babies are not intended to sleep with blankets. So this is probably a difference from the way that your mother or your grandmother put their babies to bed. When I know when my children were little and when I put them to bed, they had a bumper around their mattress. They had all kinds of blankets and stuffed animals and pillows, and I'm glad they survived. But the reality is that we now know that that's not a safe way to put your child to sleep. And so I think that most people get information around the fact that, just the baby in the bed, that's what you need. But the fact is that, sometimes we get well-meaning advice from our mothers, our grandmothers, and they feel like their children survived, they did quite well, and they know how to take care of a baby. But advice has changed. The times have changed. We've learned more. And so we just want to remind everyone that the safe way for a child to sleep is alone, on their back, and in their crib. So be sure that everyone who watches your baby practices these safe ABCs of safe sleep. Because as we can all agree, it is a tragic situation when an infant dies, but it's even more of a tragedy when they die from something that was totally preventable. So thank you.
Thank you, Dr. Amler. Next, I'd like to ask Lisa Syron, coordinator of the Child Fatality Review Team from WIHD.
Thank you. The Child Fatality Review Team has the tough job of reviewing and learning from fatalities of children in the county to figure out how we can prevent such tragedies for other children. And one of the things that we're focused on to a large extent is safe sleep, because the first 4 months of a child's life is one of the riskiest for children in our county, sadly. But beyond this campaign going on right now and this information that's going out, the Child Fatality Review Team is working on a sister campaign called the First Birthday Promise Campaign. And we're asking everyone in the community, not just parents, grandparents, businesses, houses of worship, civic organizations, to all help us get the message out about the ABCs of safe sleep. So you may be hearing from me over the course of the next few months as I invite you to join with us in helping to make this the common understanding for everyone in the community, as common as wearing a seatbelt. Everyone should know about this, and together we can make that possible. Thank you.
Thank you, Lisa. Next, Karen Aaron, who's President and CEO of Feeding Westchester.
Good afternoon. Hopefully when you think about Feeding Westchester, you're aware that we stand at the forefront of hunger relief, providing food to our neighbors who need it most. What you might not realize is that alongside our hundreds of partners, including food pantries, soup kitchens, and other organizations that feed the community, we are uniquely situated to get important, critical information to those we serve together. So it is our pleasure to stand up here today and let you know that we will be sharing this information, the ABCs of safe sleep, with literally hundreds of thousands of people who come to the Hunger Relief Network each month. Thank you.
Thank you, Karen. I'm going to ask our commissioner. Let me step in front of the microphone. I'm going to ask our commissioner of mental health, Michael Orth, to say a few words. He's joined on the dais by the Deputy Commissioner of the Department, Joseph Glazer.
Good afternoon, everyone. I first want to take this opportunity to thank the leadership of County Executive and Deputy County Executive for their leadership in child safety and launching this important campaign. Sadly, in the mental health field, we often encounter parents, loved ones who've unfortunately lost a child. The trauma, the pain is excruciating and something we don't want any of our families experiencing. Thanks to the work of the Child Fatality Review Team, we're now launching this campaign, some very practical, concrete steps that all of us can take in our community. So we hope this concrete steps, the emotional support, helps us fulfill our promise of having health and safe families in Westchester County. Thank you again to the Child Fatality Review Team for making this happen. And thank you, Deputy Commissioner Glazer, for serving the department in this effort as well.
We have the opportunity to highlight very many issues here in the county government, and some of which do not raise themselves to the level where everybody is clearly aware of it. For young parents out there who have newborn babies, this is a concern and an issue, and I'm very appreciative that these professionals have joined together with a very clear message of how we can try to prevent this from happening again, and to try to get that message out to as many people as possible. So thank you to the commissioners here, our colleagues at both WIHD and at Feeding Westchester for your collaborative effort. Thank you all very much, and we hope that this campaign as we go forward in the month of October will be successful. And the best way we will know that is by having no fatalities. So I want to thank you all for being with us today. As we've reached the end of our presentations, I want to check with Catherine Chaffee to see if there are any questions from the press. There are none. So any members of the press who may be following this on YouTube today can reach out to our communications department. Catherine is reachable at 995-2932. We'll be happy to answer any questions or direct you to some of the people who are with us today to answer that. As we always do, we'll have other announcements during the course of the week. We'll have this formal structured event again next Tuesday, October 12th. It's targeted for 2 p.m. Monday is a national holiday, so we will be back again on Tuesday. That's the plan. If there are any changes, we'll make that clearly announced so everybody knows, and we'll give you the latest update on COVID and whatever is relevant at that point. Tomorrow, if you have a mind, join us at 3:15 in Valhalla for the raising of the Italian flag to recognize Italian Heritage Month. I'm George Latimer, Westchester County Executive. Thanks for watching. Have a good day and stay safe.